Rajiva Gupta, who is a senior consultant in internal medicine and diabetes at C K Birla Hospital and his own clinic, Upchaar Wellness, Gurgaon, India. Welcome, Dr. Gupta.
Thank you, Manju. It's a pleasure for me to be with you and delving on this topic of diabetes. Thank you.
Thank you so much. It's increasingly become a very, very important concern for people. And so my first question to you is, why is the incidence of diabetes so high in India, and why is it increasing at such a fast pace?
Yeah, that's a very good question. And we find that the prevalence and incidence of diabetes is increasing day by day. The reasons are that there is a shift in the lifestyle of the people. There is a change in the lifestyle of the people. People are migrating from small cities and villages to the cities, and wherein we all know about the quick delivery or the quick commerce. So easy availability of food, the busy corporate lifestyle where there is hardly any time left for exercise, ongoing mental stress on account of different reasons or circumstances. So genetics, environmental pollution, that is another factor which has been recently researched to be contributing to higher prevalence. So all these factors in totality, they cause an increased prevalence of diabetes in India. Prevalence amongst men and women is almost similar, maybe around 12 to 13%. But in rural and urban differences is there. In urban areas, it is around 18%, whereas in rural it is 11%. But then lately we have been seeing that the bridge is gradually getting narrower.
Before we delve into about seriousness about what is diabetics and how do you diagnose it, I had another question about pre-diabetes. I think it puts us, a lot of us think that, oh, we are just pre-diabetic and we are not diabetic. So is there a concern when you are closer to that range, and do we need to pull up our socks at that time?
Absolutely, well said. Now, first we have to define what is pre-diabetes. So pre-diabetes is based on a fasting blood glucose levels between 100 and 125 and an HbA1c of 5.7% to 6.4%. So here I would say that HbA1c is an average of the blood sugars in the past 10 to 12 weeks. So such people who fall into this category, they are called pre-diabetes. Now, pre-diabetes means that the person may remain in the state of pre-diabetes in time to come, or once he crosses those thresholds, which means his fasting blood glucose exceeds 126 or more, HbA1c exceeds 6.5, then he would be classified as having diabetes.
Right.
The prevalence of pre-diabetes is pretty high in India. So almost 25% of people, adults, ages between 18 to 69 years, they are having pre-diabetes. Pre-diabetes can be reversed, which means that we can become, which is called a normoglycemia, which means normal sugar levels.
Right.
Provided that we engage ourselves in a healthy lifestyle, which means regular exercise, diet control, reduction of weight, reduction of mental stress. So the continuum of pre-diabetes would be, it can become normal, it can remain as such, or it can proceed to diabetes. As soon as you identify it, we should take proactive measures.
Let's now delve into the subject as such. What is diabetes, and how do we see the early signs of diabetes in a person?
Diabetes is a chronic condition characterized by the body's inability to regulate blood sugar glucose levels properly. This occurs either due to insufficient insulin production by the pancreas or the body's resistance to insulin, the hormone responsible for helping glucose enter cells. Elevated blood glucose over time can lead to various health complications.
So it is defined by the blood values, the glucose levels. The glucose levels fasting should be, if it is more than or equal to 126 milligram per deciliter, the postprandial blood sugar more than 200 milligram per deciliter, and HbA1c more than 6.5%.
Okay.
Now, these have to be taken and in conjunction, and usually they should be repeated on 2 occasions for a final confirmation of the symptom.
What are the early signs or symptoms of diabetes?
Most of the people who are diagnosed with diabetes, they are in an asymptomatic, which means they are diagnosed when they do not have any symptoms. Just they go for a regular checkup or a preventive health checkup and they find that they are having blood sugar values which make them having diabetes. Or they go for an incidental examination and the blood sugar is checked, like somebody goes for a surgery and the regular tests are done and they are detected to have diabetes. But the symptoms are also there, like fatigue is a very common symptom, getting tired, lack of energy, frequent urination in some, blurring of vision because of the changes which happen in the lens because of fluctuation of blood sugar levels. Some people have pain in the calves because of early neuropathic symptoms. Increased hunger, usually not seen in the adults, the type 2 diabetes. So these are the common symptoms. Non-healing wounds, somebody is having non-healing, you get some infection or some abscess or something. So we go in for that. In men and women, both genital infections, if the sugars are high, they may get genital infections.
If anyone notices these symptoms, he or she should go for blood sugar.
Blood glucose fasting, PP and HbA1c.
If by monitoring you find that you have either low sugar or high level of blood sugar, what does the person do?
So low blood sugar is defined as having is the blood glucose level less than or equal to 70 milligram per 100 ml per deciliter, or symptoms suggestive of hypoglycemia. So we need to know what are the symptoms of hypo or low sugars. So the symptoms are feeling very weak, sometimes trembling, intense sweating, intense hunger, headache. And if somebody has these symptoms, then you should confirm with the glucometer the sugars, how are the sugar values. And one should take, say, glucon D powder. I advise people to take 2 teaspoons of glucon D powder and put it on the tongue. It acts as fast as an injection.
Right. So this is for low sugar.
That's how it is. Yeah, low sugar.
Yeah.
But then especially we have to be very cautious. These low sugar usually happens in people of long-standing diabetes and especially in elderly people who are having multiple comorbidities, kidney disease, heart disease, liver disease, etc. That is about low sugar. Now, high sugar would be defined when what criteria goal we have kept for that person. But usually more than 180 milligram per deciliter is considered to be high. In that case, usually it would not cause any emergency, except in younger people like who have type 1, which is insulin dependent diabetes. They may be having nausea, vomiting, abdominal pain, and so that is called ketoacidosis. So those people, but the sugars are usually very high. They have to rush to the hospital, get IV drips, IV fluids, intravenous fluids, and insulin. So immediate detrimental is the low sugars. They may cause problems because on their own they may cause problems on the brain, or they may precipitate a cardiac problem or a neurological problem.
At what age do we start doing these tests on a regular basis? We hear that now it's no longer that 40 plus people will get diabetes. You find diabetes in children, in young generation. How do we make sure that nobody gets missed out?
So there are no clear-cut guidelines which give us any direction about this, but as a general thumb rule, any person who has a family history of diabetes, so he should be tested, say around the age of once he crosses teens, around say 15 or 18 or 19 years, and then if the values are normal, it can be tested every 5 years. And in adults beyond the age of 30 years, it should be done every year. Especially if there is a family history of diabetes or the person is obese, sedentary.
Which are the main tests that help you diagnose diabetes?
Ideally, all 3 should be done: the fasting, the post meals, and the HbA1c. Because many times we find that the HbA1c says 6.6.
Right.
And fasting blood sugar is 110. So it becomes a difficult decision whether to start the patient on anti-diabetic medication or not. All 3 should be taken, and then we should just see along with the risk factors and then decide upon how to manage the patient just by lifestyle or drugs.
What is the medication for? Once you are diagnosed, do you have to be on medication your whole life, or can diabetes be reversed?
Yeah, so this is a burning question. It's a very hot topic nowadays. So they call of reversal of diabetes or remission of diabetes. Now, reversal is a wrong word, wrong terminology, because reversal means that the diabetes illness has been cured, it is disappeared.
Right.
However, it is not so. The better word is remission. Remission means that the person does not require any anti-diabetes medication and his HbA1c is maintained less than 6.5% for a minimum of 3 months. Diabetes remission can definitely be achieved by a meaningful weight loss ranging from about 10 to 15%, maintaining a healthy lifestyle, and doing regular exercise, freedom from stress. The lifestyle steps which the person has adopted, they have to continue, because there is a fair chance that somebody might go into remission for some time and then again the blood sugars start rising if the person becomes complacent.
Are there milder medicines which are given earlier, and if they don't work, then you give insulin by injection?
The therapeutic choices in diabetes has expanded exponentially within the last 15 to 20 years. The gold standard was metformin. So that's a very commonly used drug which is well tolerated. Then there are sulfonylureas, which were, if you have heard of glimepiride, Amaryl, and so forth, so and so forth. They also reduce blood sugars, but they cause weight gain and they may cause low blood sugars. Then there are some called maglitinides, not much used. Glitazones, again, not much used. The common medicines which are used are called DPP-4 inhibitors, like linagliptin, sitagliptin, and another group of medicines which has been available in the last about say 10 years is SGLT2 inhibitors, which increase the elimination of blood sugar through the urine,
Okay.
which also produce weight loss, and which have also got protective effects on the heart and the kidneys.
Okay.
And then there are medicines called GLP-1 receptor agonists, which are available in oral as well as injectable forms. You must have heard the names of Wegovy, Mounjaro, and Ozempic. So these medicines have also got cardiovascular and renal kidney benefits. These are called non-insulin choices.
Right.
And normally when we find that the patient, despite having a good lifestyle and still the blood sugars are not getting controlled, then the option of insulin is taken.
Right. And are there a lot of side effects of taking insulin regularly for over a long period of time?
It requires monitoring. The main side effect is low sugar. Now, low sugar is essentially a factor of activity, diet. There should not be mismatch. So many people are not regular with their diet. They are dependent upon their mood, feeling like eating, then they eat, otherwise do not eat and take insulin. So the person might go into low sugars. We have also to be cautious about insulin use in senior people, elderly people, or people who are having other problems like kidney disease. So the main is a low sugar, but then it can be managed if you are more careful, monitor it frequently, and keep in touch with our healthcare provider. And so it's a dynamic process, it's a continuous process. Increase of doses or decrease of doses, that keeps on going. Today we see, so what is called, it is not, we go by the presence of comorbidities. So
Right.
obese, non-obese. No, obese patients, so they will say the first line, they recommend the recommendations are first line SGLT2 inhibitors or GLP-1 receptor agonists.
Right.
Non-obese, you can choose like drugs with like DPP-4 inhibitors, sitagliptin, linagliptin, etc. Patient who has had a cardiac problem, again SGLT2 inhibitors, first choice, then GLP-1. Kidney problem, SGLT2 inhibitors, GLP-1 receptor agonists. But then the choice of drugs is not the only thing, it's the cost also, because the GLP-1 receptor agonists are expensive. Almost a month's therapy would be costing somewhere around 10 to 15,000.
Right.
So it should always be, we should be transparent as the doctors, we should be transparent with our patient. Yes, this is what the choice is and it is advisable, but then the consent has to come from your end.
Doctor, also what we normally hear is that the diabetes and its medication may have negative effect on the heart or the kidneys, which is worrisome?
I think I would break this question into two parts. One is the complications of diabetes. We'll just talk in very few words. So there are two types of complications in diabetes. One is called the microvascular, which means that the smaller blood vessels of the body are affected, which are principally the eyes, retinopathy, nerves, neuropathy, and kidneys, nephropathy.
Right.
Then there are the macrovascular complications, where the diabetes affects the bigger vessels of the body. So if it affects the heart, it is called coronary artery disease, where people suffer from myocardial infarction or heart attacks or angina. Then the brain arteries of the brain, stroke, or the arteries of the legs, which is called peripheral artery disease. That is one thing. Now, when the over the years, the previous few decades, a lot of medications were introduced, and some of them were found to have adverse effects on one of these organs. So therefore, when I mentioned about that glytozones, pioglitazone, etc., so those medicines are hardly being used, perhaps almost not being used, because they were found to have adverse effects upon the heart.
Right.
So the FDA in US, they made it mandatory for any new anti-diabetic drug first to go through rigorous adjudication for cardiac safety.
Right.
So that's why it is not that the medicines, if they're being used judiciously and carefully, they won't have effect on the heart. However, if it is not taken care of, the patient goes into low sugars, hypoglycemia, that can adversely affect the heart. So one has to be careful. And then after that, from safety, we move on to cardiac benefit. So all these drugs which I mentioned, SGLT2 inhibitors, GLP-1 receptor agonists, they were the first, I mean, the classes of drugs which are not only cardiac safe, but also beneficial in patients who already have a cardiac disease.
Beneficial in which way?
See, for example, if you take kidney, they reduce the aggravation of the kidney function.
Okay.
Preserve the kidney function. Cardiac problems, so they do two tests, say, group of people, one group on not on that particular drug, another is on the particular drug. They find that the long-term outcomes are favorable. Patients who were not on those drugs, they suffered, say, cardiac problem or heart failure or heart attack or stroke.
Right.
This is the beneficial effect.
Okay. You told us about the effect of the medication and also effect of the diabetes on these small or big organs. So on the latter one, how do you really prevent that your diabetes does not affect the rest of the body in a harmful way?
Yeah, so the principles are that we have to control the blood sugars as effectively as possible. So I'll give you the targets here, goals, which are average goals, but which have to be individualized in a particular person. Fasting blood sugar 80 to 130 milligram per deciliter.
Right.
Post meals less than 180 milligram per deciliter. A1C ideally less than 6.5%, but in majority of the persons less than 7%. These targets are flexible because somebody you find who is 80 years of age, 85 years of age, almost bedridden or suffering from some advanced medical problem. So probably our aim would be to just modestly manage it. Even an A1C of 8.5 or 8 would be acceptable. A person now the endurance and physical health is variable. A same person is 70 years of age, very physically very active, goes for walks. So probably his targets would be as tight as a person who is around 40 years of age. If you have to prevent diabetes, everybody is at risk. It is, yes, people who have a family history, they are at a higher risk, but everybody is at risk given the environment which we are living in, abundance of food, lack of exercise, mental stress, all these things. So we have to see to it that we engage ourselves in a healthier lifestyle in terms of our diet, regular meals, low carbs, low processed foods, and low saturated fats, regular exercise, at least 45 minutes of walk per day, intermingled with a little bit of resistance exercise and yoga, and proper sleep, 7 to 9 hours of sleep, avoidance of smoking, maintaining a healthy weight.
Right.
So these are prevention. And the same things apply also for treatment of diabetes, because the lifestyle is the foundation of treatment of diabetes. Plus medication adherence, regular medication, regular monitoring, and making the treating doctor cognizant of any adverse effects if the person is facing, and regular follow-ups as guided by the treating doctor.
So, what is, Doctor, what's your final message to the people, to the patients who are suffering from diabetes?
So, having to accept that the person has diabetes is a tough task, especially in the first encounter with the doctor. But then we have to be lucky, and we are lucky today with the therapeutic armamentarium which is available with us, that people who are having diabetes, persons who are having diabetes, they lead a normal life provided they adopt a healthy lifestyle and monitor their sugars regularly, keep in touch with their healthcare provider on a regular basis, and the life is very fruitful. They have a fulfilling life, able to enjoy all the activities and whatever they love.
And in terms of the life, the long life also, it's not affected. If you do all these things,
the life expectancy, if in the life expectancy is not affected, people who are well controlled.
Right.
Whenever we talk of adverse things in a society or friends or relatives, etc., it is people who already have suffered complications.
Right. Okay. So that's we end on this positive note that even if you have diabetes, it can be managed very well and you can have a full life till the end. Yeah. Thank you. Thank you so much. True Health Stories and Doctors' Talks on our channel raise awareness on health issues and also empower you to ask the right questions when you make a visit to your doctor. These also inform and encourage you to get preventive tests done. Like, share, and subscribe to our channel, Health Stories Speak. If you have a genuine story to share, get in touch with us at healthstoriespeak@gmail.com.